Hi, this is Prakash here. I wanted to share two small anecdotes quickly and then infer something out of that for us to manage this lockdown and post lockdown COVID situation. Situation 1. There was this teacher who went and met the principal and said, I have a challenge with my students. So the principal asked him, what is it? Said, I had shared the model question papers and the proposed syllabus for the next year with the students who are about to take the final exams and pass on to the next year. I said, okay, good. What happened? So the students are objecting to the questions and as well as objecting to the syllabus for the next year. Let's go to the anecdote 2. There was this duty doctor who went and spoke to the chief saying that there is a small procedure that is to be done for this patient. It needs a small but invasive minor surgery. So the chief said, go ahead and do. He said, as part of the protocol, before the surgery, I spoke to the patients and the caregivers who have come with the patients. And they were saying that according to the Google search that they have done, and the people who are informed, knowing to them, said that this is not the right procedure. In both these situations, there is one thread which is running common. There are certain LOCs, line of control, that are not to be crossed if the student has to pass and do well in his career, or the patient has to survive and get out of the hospital and become better in his health. The same is true in many of the leadership situations that I see in this crisis situation, in this pandemic. Extraordinary situations like this call for certain extraordinary measures, tough ones, balanced ones, well thought out, visionary actions. Many times it's impossible for all team members to get on board and understand what exactly the leaders are thinking. While it is perfectly all right for a leader to get his team on board, it's as much impractical or illogical as a teacher wanting to convince the students about the question paper or the syllabus being set, or the doctor convincing that this specific surgery is the only solution. There are times when experts give certain opinions, and then due to the internal equations that the leaders have or that they don't have, such important decisions or important strategic inputs are overruled because of the factor of mob mentality, as they say. As a leader, this is a time for you to take considered, solid, strong decisions. Take inputs from people who really matter, not necessarily all the stuff. At the level of execution, they still might have to cooperate, but they will understand. But as a leader, you are always in minority. And it is always the minority which has to take certain decisions because of the uniqueness of the position, the power, the authority that has been given to the leaders. That is precisely the reason why you are sitting there. Talking to experts, getting their inputs and insights would really help you to clear the cobwebs out of your head. But please bear in mind, you are the captain of the ship. If you have to satisfy everyone's whims and fancies and emotions, it's impossible to take the ship to the shore. Think about it. Let's meet again on this platform on how to survive in such tough situations, how to stabilize, and how to surge ahead in the business. Let's meet again. I wish you the very best. Thank you.